All right, people, I want to talk about care plans. And do they matter, or are they just something that is really kind of like a tasky kind of thing in nursing school? And it's not. It's really, really not. In nursing school, I didn't realize how important they were. And then I got out as a nurse and then thought, God, this is just like a task. But then once I really developed my critical thinking, I really realized how important they are. So I just wanted to just describe to you that you're gonna do this. It's just right now it's really hard. And it's really hard because you haven't seen a ton of patients. You haven't seen, all these patients with various diagnoses and then different kinds of ways to address them and progress those patients. So, nursing is much more than just getting through your shift, and it's much more than just, okay, I have these meds to give, I have to give a bath, I have to educate about this and check. It's about progressing patients and getting them to discharge sooner. If you are a proactive nurse that utilizes care plans, and keep in mind you'll probably do this without even realizing it, then your patients are going to be more successful. They're going to get out of the hospital sooner. Let's say I have a patient that had a back surgery and they've got pain meds and they just want their IV pain meds as they're due, and they want to take a nap and they only want to eat a little bit here and leave me alone. And so if I'm their nurse, let's say I'm don't care about care plans and I don't care about the progression of the patient. So what I'm going to do is when they ask for payments, I'm going to give them. When they have scheduled meds, I'll be in there. I'll do my hourly rounds. I'll do this, I'll do that. And that's great. But at the end of the day, did the patient get better? Did they maybe advance from getting all IV pain meds to being transitioned to oral and IV pain medications? Did this patient get up and progress and get moving so that they can get home sooner? So let's say you have that nurse, or you have a nurse that gets report and is like, okay, so this patient's getting IV pain medication, they had a back surgery, they've got physical therapy order, they're supposed to be up and out of bed. Maybe they don't want to, but maybe they don't understand why it's so important. So the proactive nurse that's thinking about care plans is going to think about acute pain. They're going to think about generalized weakness, maybe. Maybe they're going to think about, what else could they think about? Impaired mobility and those kinds of things to promote progression within those problems. Hey, this patient has these problems. I'm going to make a diagnosis, a nursing diagnosis, not a medical diagnosis, but a nursing diagnosis, and I'm going to give myself a starting point. And I'm going to give this patient a starting point. Hey, this is the situation right now. This is where I think they should be. These are their goals. And they're not just goals to have goals. No, really, this patient needs to get to this point. And then I'm going to think of interventions to help me get there. And then how did I do? Could I implement all of my interventions that I wanted to? Implementation. And then how did I do? Evaluation. Or not just how did I do? How did the patient do? Maybe the patient didn't meet all their goals. Maybe not all the interventions are realistic or helpful. So it's like, this is the kind of plan and how did it go? And it's just because your care plan wasn't necessarily successful, or maybe there were certain things that could have been done better, that doesn't mean you're a bad nurse. That just means, hey, I need to optimize, or maybe this didn't work, or I had this obstacle I didn't anticipate. And you open up these care plans on these patients when they arrive and when they get to your unit, and then you progress them every day. You resolve the ones that are done and that all the goals are met, and then you open new ones as they become appropriate. So going back to that back pain patient, hey, my goal is going to get, one of the big goals I'm going to have is to have better pain management to enable them to get up more. I'm going to try to get off that IV stuff because they can't go home on IV meds. So, okay, my goal is going to be that the patient's pain is controlled 5 out of 10, whatever is an acceptable level of pain for them. On just oral pain medications. This is a very specific, measurable, great goal that progresses them in their care plan, progresses them in their progress to get them home. I think people really view nursing care plans and medical care and medical diagnoses as two totally different things. And while we function differently, we should complement each other to facilitate getting that patient home sooner. So we do that with the pain, with the mobility. Hey, at the beginning of the day, let's have a powwow. It's really important, even if you're in pain, because I know it's going to hurt. And the key is pain management, not pain elimination. You had a major back surgery. It's not realistic that we're going to get rid of all your pain and your pain's going to be gone and that's when you're going to get up. No, you're going to have pain. It's going to be tough, but we're going to get up. Because the more you get up, even though it sucks, the more you get up, the faster you're going to heal. So having that little powwow at the beginning of the day, touch and base with physical and occupational therapy. Hey, we want to get this patient up multiple times. Let's kind of maximize that. Hey, let's get up to the chair 3 times a day. And maybe we won't do it 3 times today, but hey, we're going to get to the chair for 1 meal today, 2 meals tomorrow, 3 meals the next day, or something like that. So that we're making progress to get home. Because it's not just like kicking back and, hey, we'll just do what the doctor tells us until they go home. It's like, no, I'm going to use my nursing critical thinking, my nursing judgment, my clinical judgment, my care plans to progress this patient, because my care and my clinical judgment is important as well. It's not just the physician making these calls. I have a very real part in this process, and that's a really important thing that I want to make sure that nursing students understand, is how important that role is. And right now at the beginning, you're learning how to do it, and it takes some time to kind of wrap your mind around it because you haven't seen a bunch of patients yet. If you think about it in the medical standpoint or the medical point of view, it's like, hey, I've not seen a whole bunch of stroke patients, or I've not seen a whole bunch of patients with these diagnoses. And I've got to work really hard to figure out, okay, put the pieces together to come to this diagnosis. And it takes a long time in medical school, and it takes a long time for those newer doctors and those residents and stuff. But eventually, you get to see a whole bunch of different patients and you understand more as a physician. Same thing with nursing. You haven't seen a whole bunch of patients with impaired mobility, generalized weakness, acute confusion, acute pain, fluid volume deficit. You haven't seen a lot of that, so it's hard to okay, a patient has fluid volume deficit. How do I know this? How do I treat it? What are some realistic interventions and realistic expectations? What are helpful interventions? It just takes time. So they're really important, and I don't want you to think this is another task in nursing school. It is so important, and it really elevates, if we do that well and progress patients within their care plans, it really elevates our practice as nurses.